Good day, everyone, and welcome to the first webinar in the year 2024. I'm so excited. I am Iyasiri Oluwaseun-Sira. I am an associate professor at the Department of Animal Physiology, Federal University of Agriculture, Abeokuta in Nigeria. But currently, I'm a George Foster Research Fellow at the Humboldt Universität zu Berlin. And I'm happy to welcome you to this webinar presentation. The Animal Welfare Group Nigeria was founded in 2019 after a gathering of students and lecturers from the Federal University of Agriculture, Abeokuta, Ogun State, Nigeria. And we have three main missions, which are to increase awareness of animal behavior and welfare in Nigeria, Africa, and the world at large. Secondly, is to foster collaboration and networking among researchers who are in the field of animal behavior and welfare. And thirdly, we are here to educate the public on the importance of animal welfare. We meet every first and third Wednesdays of the month, and we discuss issues which are related to animal behavior and welfare. So thank you for joining us. Today we have Billie Groom from Canada, and she will be presenting to us. And before I hand over to her to continue with the presentation, I would like to take her biography. Billie is a social entrepreneur and innovator in the canine behavior and human-animal welfare domain. She is the creator of Canine Cognitive Behavioral Therapy, a scientifically proven methodology that addresses behaviors associated with anxiety and aggression among adolescents, adults, and adopted dogs. She is the author of an award-winning book, a podcast creator, a host, and a speaker at universities and conferences. She is the vice president of the Dog Writers Association of America, a member of the Animal Behavior Society, the Comparative Cognition Society, and a graduate of the University of Western Ontario. She recently completed the Animal Cognition and Emotions to Improve Animal Welfare program at the Swedish University of Agricultural Science and is enrolled in the PhD program at the School of Leadership and Change at Antioch University. Her method, which is the upward dogology, is proven to decrease surrenders and euthanasia, increase adoptions, and eliminate the perceived need to use aversive or harmful measures. In the last 3.5 decades, she has worked with dogs from the Korean meat market, dog fighting rings, and the streets of Central and South America. Reserves in Northern Canada and Spain, ex-police dogs, dogs from war zone, and well-adjusted dogs displaying typical adolescent behaviors. So permit me to welcome Billie Groom to deliver her presentation.
Thank you so much. Thank you for having me. It's a great opportunity. And wow, everyone for showing up from all over. This is wonderful. Thanks. Some of you. Hi, Abdul and Altamush. Hello. Thank you so much, everyone. I'm excited to be here. I will say I am probably perhaps the only one that's not doing a video presentation. I just wanted to be able to speak a little bit on cognition and how it fits in with animal welfare, what exactly it is, and why it's important to recognize the cognitive abilities and the intelligence and the emotional intelligence of animals. And my area, of course, of expertise is canines. And how, in doing so, we can help these animals become part of our family, become part of our community, and to be able to help them thrive as well as help ourselves. Because we as humans, we also want to be able to help these animals, bring them into our lives, and to have a mutual understanding and a companionship. So when we're talking about, well, I was going to start with an introduction, but Sarah did that. So if anyone has any questions about my history on learning this, feel free to ask. But in short, it's a lot of what was part of the introduction. But I think the biggest thing was that I really didn't intend to be a behaviorist. My goal was to learn more about why dogs, especially in the adolescent stage, were being surrendered and euthanized, and why people were resorting to methods that were perhaps considered aversive or abusive during that adolescent stage. And upon researching that, I took in a lot of dogs into my home that had all sorts of different paths, including dogs that came from very good upbringings as well. And in that adolescent stage, things just changed, or they were challenging to bring in. And so I worked with them, and from working with hundreds of these dogs, I learned what worked with them. I never actually studied to be a dog behaviorist. I never studied or intended to be one. As my method developed and grew, and veterinarians and rescue organizations and pet parents started learning about what I did, it developed into that. And as I'm starting back 3 decades. So as I continued to work through that, I really had to sit back and think, why is what I'm doing working? Why is it different than what is in standard dog training? And in doing so, I worked with veterinarians and with psychologists. It was a huge learning journey for me. It really was very interesting. And at one point, a child psychologist said to me, what you're doing is more like cognitive behavioral therapy than like conditioning. Traditional dog training methods are grounded in conditioning, operant conditioning, classical counter conditioning. Whereas what I do follows a process that adheres to the principles of cognitive behavioral therapy. And that sent me on a whole new path. That sent me down a whole new road, studying cognition, cognitive behavioral therapy, why and when it is more effective than other methods at certain stages, life stages, reason for the behavior, upbringing, all sorts of different reasons. They're both equally effective. They're both needed. They're all needed. All non-aversive methods are needed in the behavioral realm and in the welfare realm, so that we can pull those tools from that toolbox that's best for that dog in the stage that the dog is at, and what our goal is. With the adolescent stage, we get a brain development just like we do with humans. And without getting too deep into that brain development, if you sort of think of teenagers where they suddenly hit that stage where they know right from wrong, they don't care, they're not processing a lot before they're making decisions, they're just making quick decisions. That is a lot to do with brain development, a frayed connection between I'm not going to get too much into it, but different parts of the brain where we would normally have inhibitory neurons that allow us to stop and process and think and make better decisions. That is also what's happening in the adolescent stage with dogs. So you'll find people will use terms like, it came out of nowhere, or my dog knows right from wrong and he's just purposely not doing it, and knows come when called but doesn't do it. It's that stage that can be challenging. The methods that are used during puppyhood are intended to teach right from wrong. Those are conditioning methods, operant conditioning, and they work very well. But when that brain development happens, they can lose a little bit of grounding in there, and that can become frustrating for people, leading to the surrender and hopefully not euthanasia, but also leading to methods that, or even not even methods, dogs just being put outside, or we need to work with that and to develop, harness those skills. When a dog has been born or lived independently on the street or in a community, they're using a lot of cognitive skills. That's why they're still alive. So when I talk about cognitive skills, attention, processing, learning, problem solving, reasoning, creativity, making decisions, being able to put 2 and 2 together. And because those abilities are strengthened during the adolescent stage, they're going to start using that to decide their behavior. And when their behavior is decided by either emotions, which is emotional intelligence is part of cognition, learned behavior, such as putting their head in a garbage pail they're going to get yelled at, whether they learned that on the street or in a home. It could be learning that certain people are nice. It could be learning that certain people are mean. It could be learning that if a dog growls at them, it's better to leave. There's lots of learned behavior all the time, and that's cognition. So as they start to learn that and to make their decisions and their behavior based on that, we need to work with them using an approach that harnesses those skills. And that's exactly what I learned through my journey. I learned from the dogs how to do that, and I learned from people why it works and why it's important and why we need to harness those emotions and allow them to stop, process, think, make decisions. And that's how those methods are different. Another comparison that was given to me by a psychologist, a child psychologist, was when a child is 3, you can teach them the concept or the idea or the actual action of sharing. So they understand that sharing means that they take half their crayons over to their sister and that they get rewarded and praised by their parents, and it's a good thing. They understand sharing means, okay, this is what I do. Sort of more like an action that we would teach a puppy, like sit. If I sit, I get patted or I get a treat. So it's more of an action, and they're learning that it's a good thing to do. When they hit the age of 4, they start to question that. Do I want to share? What happens if I don't share? Do I have options? Can I share half my crayons? Can I share all my crayons for 15 minutes? And they start to ask these questions. So as parents, hopefully, not that I'm a parent of a human, but hopefully we adapt the way that we parent and we start to grow with the child and to harness those skills. And just because they're not always making decisions that we like, they are making decisions based on increased cognitive ability. And that's why once we start to morph over into using a method that harnesses those skills by inducing processing, inducing decision making, recognizing autonomy, providing agency, providing the ability to make those decisions, and to recognize what's important to them individually because they're older. I'm not saying puppies don't have emotions or feelings or what's important to them. They do. But when we're working with puppies, we're more so in the stage of teaching them right from wrong. We can do that with simple replacement training. So know that the sock is not good to have, a toy is good to have. When we start dealing with dogs that have cognitive ability, and it's been proven, or there is evidence to show that dogs have the ability to recognize object permanence. This has been studied in labs from scientists. So a dog might recognize when you're going to try to hide their toy in a cupboard. Throw a treat down the hall, hide the toy in the cupboard. They're not, no. I know you've got my toy and I know that you're putting it in the cupboard. And I don't want to stop playing ball or whatever it is. I'm not going to go get that treat down the hall. Or if I do go get it, I'm going to come right back and jump on the cupboard. Because those skills aren't developed, sort of forgets that you put the toy in the cupboard and you can sort of distract with something else and have it work. But some of those methods don't work as well as they get older. And that's where your cognition comes in. Or they can watch and see that you're putting your foot on the garbage lever and that it opens the garbage pail. And they saw you put the chicken wings in the garbage pail. So they know that they're in there. They know how to get in there and they know it's wrong to get in there. But when you turn your back, or let's say you leave at a time that they don't think you should leave, or they think you should be paying attention to them, they have those cognitive abilities to put 2 and 2 together, and they might go do that to get attention, or they might go do it because they know you're not watching. Whereas a puppy and not be able to quite do that, or if they start to do it, you can just say no, let them know it's not the right behavior and give them something else to do. So I love the adolescent stage. I love that brain. I love working with it. And that is why I created this method. Well, like I said, the dogs taught it to me, and it follows the principles of cognitive behavioral therapy for humans, which is a scientifically proven method. And it's geared more to not to teach right from wrong, but to recognize that the behaviors are stemming often from emotion. And that's why it works really well with anxiety or aggression or behaviors stemming from anxiety or aggression. It's intended to do that. So the goal and the intent of methods is very important. Once we recognize why a dog is doing a behavior, we can apply methods that work in conjunction with that. So if a method is stemming from just simply not knowing right from wrong, we could use conditioning. We can also use counter if it's emotion. Counter conditioning changes the perception of the stimuli. So if a dog is reacting to a big man with a baseball cap, for example, which is common, they can use reactive reinforcements and associative elements to change the perception of that stimuli. Cognitive behavioral therapy isn't intending to change the perception of the stimuli, but rather to reset the brain so that they can change their own perception of their need to react. Do they need to react to stay safe? Do they need to react to stay alive or to keep their bone or to keep a subject at bay? Sometimes they're doing that. We can think of that as humans. We do that as well. We make different decisions if we know that we can achieve our goal without expressing anger or anxiety or fear or feeling that way or having our brain go to that place that is uncomfortable and causing us to feel fear. If we can actually address our situation and be okay with the outcome without going there, we will choose to do that. That's an intrinsic reward. So we will choose a behavior that achieves our goal without having to feel panic or fear. And that's what CBT does with humans as well. So we can stop and process and think and make different decisions. So instead of reaching for the cigarette or the bag of potato chips, or instead of going into a place of panic or fear, we can stop and breathe and process and make different decisions. Is our perception of, let's say, for an example, going back to the big man with the baseball cap, is the perception of that man changed? Possibly not, which makes it different from counter conditioning because we're not doing associative elements. And when I say associative, counter conditioning might use a positive, like a treat or a positive toy or a pat, so that when the dog looks at that negative stimuli, they're associating it with a positive. Whereas CBT simply allows the dog to process and decide for themselves that they don't need to bark or lunge or bite, but their perception of that person might not change. They might still, yeah, I'm really not big on that person, but I'm okay with walking by that. And then from there, just as with humans, it progresses. So it's not overly time consuming, but we work outside of that. That's another big difference between the methods. Is all conditioning methods need the stimuli present in order to change the perception of the stimuli, or in order to just teach in the first place with operant that people are good. That's your basic socialization. So with CBT, we actually do a lot of work, brain work, processing, exercises that induce decision-making and induce processing and harness cognitive skills, allow for change in routine. That's another big thing, cognitive dissonance. We go into an area and something isn't as we expect it to be, and that causes us panic. It's not that we don't like a certain person, we just didn't expect them to be walking into our house right then. Or we might go to a bar and people are happy and jumping around and being silly, and we're okay with that because it's a bar. But we go into a library and people are like that, and it causes us a little bit of concern. How we choose to manage that is going to be different depending on how we have learned and practiced our brain processing and being in environments that cause us discomfort. How will we approach that? Will we stay and try and figure it out, or will we choose to leave, or will we panic? So we're working on the brain being able to do that and to be okay with change in routine, okay with things not being as we thought they would be, or okay with watching and processing something that causes us fear and anxiety and not having to go into that panic state. That is how CBT works. So we do a lot of working outside of the situation just to practice the brain doing that. So then when we're put in it, we have those skills. So to get back to street dogs and community dogs, and I'm sorry, I'm not reading the questions, so maybe I'll stop at one point and allow for some questions. I just wanted to quickly say that dogs that come from the street or community dogs, those skills have been harnessed from a young age. So people view them as being more challenging to bring into our lives and bring into our homes. But once we learn how to work with them and learn how to recognize what's important to them, and to provide basic skills, which can be done in the first 4 days of bringing them into our home. It doesn't have to be a long time. We're literally changing their perception of us. They're literally learning that we know what's important to them. We know how to communicate with them. So some of these skills can be quite simple, but they are individual to the dog. It depends on what's important to that dog. It depends on what that dog's learned. It depends on what that dog likes, doesn't like, is afraid of. So how we work with that dog still follows the platform of cognitive behavioral therapy, where we set up platform skills and we get those platform skills early. It's almost like a communication. Be like somebody coming into your environment and you're going to learn what language. You're not just going to sit there and tell them that they have to learn a certain language. It's easier to figure out what language they know and talk to them in that language. It's the same idea. Dogs that have been raised in a home, people might do canine enrichment. They might take them to the dog park. They might send them to daycare or play dates, socialization. All of those induce cognitive skills, induce decision making, socialization. So they all have some amount of learning going on during puppyhood. How it's done is different. I see Abdul, does the age or size matter during training? Size? Interesting. Not really. They all have the same brain. With the way I work with a dog, it's their brain. Size of the dog wouldn't matter so much, although people commonly ask about breed as well. Breed is interesting because essentially, no, they all again have the same, but breed can affect overall personality so much, but I guess disposition. So example, a herding dog, such as a collie or a blue heeler, cattle dog, they tend to herd. So their goal in life is a bit different. How they perceive their world is differently. What they perceive their own goal and what's important to them is going to be different than dogs that are not of the herding category. So that's not so much size, but it can affect their overall disposition and their goal and their emotions because of that. Now, they all don't read a book on how they're supposed to behave. So some herding dogs don't act like herding dogs. The reason maybe for aggression might be because a herding dog really has that mentality commonly, if I was being very generic about a herding dog, where they like to understand their environment, who should be doing what, where everybody should be. And they like everybody to be doing exactly that, and they will herd you to do so. So when that doesn't fit into their perception of what should be happening, they could respond accordingly. Whereas a dog that's not a herding dog might not feel the need to do that. As far as age, definitely. So you have your different life stages. Puppy, I would suggest conditioning methods, standard conditioning methods. Sometimes in the adolescent and older, conditioning methods continue to be effective and dogs like it. And that's what they gravitate to. Great. But it is common for those change in behaviors due to brain development to need to switch over to CBT, harness those cognitive skills, induce decision making, recognize the autonomy, provide agency. And then when they get over 2, sometimes we can kind of combine those a little bit, or sort of wean off of having to do, and then you just sort of get your your dog that the brain is more fully developed. And so it depending on how long the person's had the dog, but if they've had the dog for a while, they might just have that natural bond by that point. You don't really need any particular method. They've got that bond, they've got it going on. So yeah, there's different life stages, brain development, and also the personality of the dog, which method they like, just like people. Same in male and female. Ooh, interesting. Love to have a veterinarian chime in on this one. I mean, I have a lot of case studies. I have about 150 clients per year for 3 decades. I also work with rescue organizations and fosters. So you get a lot of opinions on the male and female. My first reaction would be to say no, but there are hormones in there, and hormones affect behavior and processing. So, and again, then you might have a male that is either neutered or not neutered, might make a difference as well. I don't think neutering a male is definitely going to, right off the get-go, stop aggression by any means. But neutering a male dog can increase the success rate of a method that is working with that dog, just because it allows for increased processing. But overall, I'm going to say no, but I'd be open to people with their opinion on the male female. What is anxiety like behavior in dogs, and what is the influence of the? Ooh, this has become very popular, where people say that they're influencing. I find that interesting. So anxiety like behavior can be hesitancy, following people around a lot. People love when their dog follows them, and there's nothing wrong with it. People never hire me. Oh, my dog follows me, I need a behaviorist. But it is an indication of anxiety. And often once we start working together, one of the first things my client will say to me, and this can commonly be hours, if not a day or two, but it can be almost immediately, wow, my dog just didn't follow me as much. Great. Now we know that that dog's stopping and processing and not feeling that need to follow. It could be chewing, uh, messing in the home, hiding, whining. There can be lots of signs of anxiety. Some people confuse separation anxiety with FOMO. Sometimes they just have fear of missing out. They just want to go because they think wherever you happen to be going is probably super fun, because the only place you ever go would be on a dog walk or, to the dog park. So they could just have FOMO, which is not anxiety at all. It's silly, happy dog wanting to go. But separation anxiety and FOMO could look similar. They could be jumping and barking and whining and jumping at the window, or if you have them in a crate, jumping on the crate door, wanting to go. So it can look a lot of different ways. The reason for it, sometimes when I start working with a dog or a client, we don't know the reason for the anxiety, but with CBT, we learn that very quickly because we apply the skills that allow the dogs to tell us that. The pet owner, yeah, that's a big thing. People say, well, the dog can feel my anxiety through the leash, but it's one thing to say to people, just relax. They need skills to relax, or to be patient. They need skills to be patient. Once pet parents have skills and they see progress in their dog and they see their dog changing, thinking, learning, they feel a bond, they feel that they're attaching to their dog, an attachment, a mental and emotional attachment, and they feel that they have the skills, right? As we build the skills, which I keep talking about, those platform skills with the dog, once we build those, they create a bond. And once we start to advance and enhance those, it provides the pet parent with actual skills that they can use to connect with the dog's brain during these more challenging times. So inherently, relaxes the pet parent. Inherently, the pet parent is calmer. The dog is calmer. They're connecting. So yes, it does make a difference, but it's very challenging to just say to people, be patient, or just relax, your dog is fine. It's hard to do when you have a 75-pound dog losing his mind on the end of a leash. Pet parents really need these skills, and trainers need these skills to be able to teach to pet parents, and then what the result of that is positive and calm. What about climate-induced trauma, like dogs that have seen? Oh, love that question, Altamush. I love it. Yeah, I've been dealing a lot with dogs from war zones, which I know that you're environmental, and congratulations on your success with that course and getting your degree, by the way. So yes, you are the pro on environmental. Yes, it would. One, the challenges in finding food if they've had to find food on their own. And also what's happening just in the environment in general with people and the humans around them and the other animals around them, what they've been eating. Dogs that have seen disasters, well, I think anybody who's seen a disaster, I mean, they have emotions and they have feelings. So I think it would be the same. I doubt worked a lot with dogs as well that have lived in areas where there's a lot of gunfire, not just war zones, but just where guns are legal and whether there's a lot of hunting. Sometimes they become completely immune to it and they don't care at all. It's like, yeah, it's Big Bang, whatever. Other times it sets them off and can confuse them. And that gets into, again, another cognitive skill where some dogs need to be able to process visually what's happening around them, and that calms them. So if they can see what's causing a noise or see what's causing their environment to be that way, they're more comfortable. Whereas other dogs can hear noises, and if they can't like thunder or a gunfire, and they can't process where it is, but it's not immediately in the room that they're in or immediately affecting them, they don't care. It's like, oh, it's something over there, I don't care. So dogs are like people. It really depends on how it affects them. But yeah, I'd love to talk to you more about that. Can a dog's social and cognitive behavior be influenced? Yes, that was similar. The temperament of the owner. That's interesting. Definitely the environment and the owner's lifestyle. So they're going to have different socialization. I mean, people are so all over the map. Humans are so crazily all over the map in their temperament. Whether it would affect the cognitive skill, I think lifestyle would. I think it would affect the emotions of the dog, which is cognition and emotions work together, influencing a dog's behavior. So yes, definitely. Again, I think that would go back to providing the pet parents with hands-on effective measures. And then that would prevent the person, hopefully, from getting frustrated, probably help with the dog's temperament. Having said that, there's dogs that come from horrible, horrible situations and they've been treated horribly by humans. And they as soon as they get with a person who shows them love, they're insta beauty dog. Like they move forward and think, well, that person was awful and this person's nice, and forward I move. Again, there's so many different dogs that I've worked with and that have come from so many different situations and the impact on them. It would take a one health approach, I think. I think we need to have a one health, one welfare approach where we take all these different factors and allow to have a method, which what I love so much about CBT is it's flexible, it's creative, it's adaptable to the different dogs. And once you learn how to do that, I am starting a course, by the way. I am in the process of starting a course. It'll be about 8 months long to teach CBT to people that want to work with dogs using CBT. And it's a very long course because once you understand how to apply it, it's actually quite simple. It's very, it's simplistic in a sense, but it's not simplistic from a psychology. You need to understand how it works and why it works and how to apply it. And once that is understood, it's like any other formula or method. You go back to that formula and method, but it allows us to understand a lot of those questions and understand how the dog feels and then make decisions based on that instead of teaching right from wrong. Essentially, a dog never does a wrong behavior. They do what they feel they need to do. And we need to understand that. And that's what CBT allows us to do. Sorry, I digress there a little bit, but that's really important to me. What are the challenges faced by street dogs and how does this affect their cognition development of behavioral disorders? Yeah, well, a lot of those challenges increase their cognitive skills. So crossing a street, learning to watch cars. It's funny, when I get in dogs from the reserve in Canada, we have a lot of reserve dogs here, which are very similar. They are street dogs, essentially. They find crossing, the city I live in, we have a lot of crosswalks. They're challenged by this. They'll stop and there'll be cars at the crosswalk. And they're, no, Billy, I'm not crossing in front of that car. I've learned that walking in front of a car is a really stupid thing to do. So I'm not going to do it. So here we are at a crosswalk with the car stopping, expecting us to cross. And that dog doesn't want to go because they've learned that is not a good thing to do until, of course, they can process that and process their new environment And I will apply my skills right there at the crosswalk to allow them to process and to make that decision. And commonly within 4 to 10 seconds, they will choose to cross the street, but they need to make that decision on their own by processing their environment. So I work a lot with dogs that have come from very good homes, were raised, by nice pet parents, and they still have behavioral issues in the adolescent stage due to brain development and being under, just knowing right from wrong, but choosing to not do the right behavior, what I was talking about earlier. And sometimes bringing a dog in straight off the street or from the reserve, those dogs just fit right in. So the behavioral consequences of upbringing is a complicated, in-depth topic for sure. I like the way I like my 4-day, 10-day, 3-week approach, which will be part of my program, and possibly a different program, a smaller one for fosters and rescues and people who adopt dogs, to bring in these older dogs that have come from non-traditional pasts and upbringings to prevent any of those behavioral issues, which is an interesting case study on a lot of them, because a lot of times we don't know what we prevented. So the aggression didn't occur, the anxiety didn't occur. Would have it? Well, based on some statistics, when, other integration, your 3-day, 3-week, 3-month using conditioning methods can work. Absolutely. Can also be challenging, require a lot of patience, and sometimes not always prevent those. So it's a matter, again, of everyone working together who has different skills and knowledge and areas of expertise to discuss that, to be able to ensure that we can proactively prevent or quickly read and address any of those potential behaviors caused from upbringing. But I think that their cognitive skills are why they're still alive. And when we learn to harness those, it's actually really cool. It's really fun to see. It's fascinating, actually. Yeah, it's really fascinating to harness those skills in a home environment. Can the same procedure be used on other animals, especially now that list of companion animals? Yes. Okay. So I just completed a course out of the University of Sweden. It was a PhD on animal cognition and emotions. And the professor was her animal of preference, I guess. Yeah, I mean, she probably loves all animals, but sheep and pigs. So we had a lot of discussion about the cognition in sheep and pigs. Pigs are becoming a very popular pet, or at least in my neck of the world. And yes, they do. They all think they all have cognitive skills. They absolutely do. They all have emotions. I believe. I think probably most people in this room. The fact that it's becoming more accepted that animals are sentient beings and that they have emotions and feelings, we need to incorporate CBT into working with them and to harness those skills, because they're becoming companion animals, but they're also part of our environment, part of our whole being. So yeah, I think just the fact that we're beginning to recognize that is a beautiful thing. What is the role of dog breed on their cognition? Yeah, I talked a little bit about that before. They all have cognitive skills. How they choose to use it. Samuel, thanks for that question. How they choose to use that would depend, I think, a little bit on their breed, but also on their personality. I think anyone that's worked with a lot of dogs, the minute that you say a golden retriever is always friendly, the next day I'll get a call with somebody who has an aggressive golden retriever, like guaranteed, right? Because they don't read the book on what they're supposed to be. But I think whether a dog is going to take to agility might be breed dependent, but then you also get dogs that are just right out of that norm and they love agility. I think it's just important to find what your dog likes. That's not necessarily CBT. That's just, does your dog like leash walks versus playtime versus playing with other dogs, daycare or not? And they go through different stages with life too. I mean, sometimes it's just like us. What we enjoy when we're younger is probably not what we should enjoy when we're older, whether we do or not. So, you know, maybe going to daycare would be great for that adolescent dog, but not necessarily for an older one, but it depends on the dog. But breed is, I think, how a dog uses their cognitive skills. But I don't get in the hundreds of clients a year, I don't necessarily get one breed over another. But like I said, if it's a herding dog and they're aggressive, it's probably because they're trying to manage their situation. They don't necessarily dislike the person or the subject that they bit, but they disliked what that person was doing because they felt it was not aligning with what they felt should happen in that area at that time. There'll be dogs that will react to a dog not because they dislike that dog, but they feel that that dog isn't following, maybe not listening to the pet parent. So the pet parent might contact me and say, you know, my one dog over here is aggressive towards this new dog that we got in, but we'll actually start working with the new dog, getting some ability to calmly manage and to bring that dog into the lifestyle, have them fit in. And then this dog doesn't feel the need to manage that dog. So we actually never worked with the aggression in that dog because it was stemming from the need to manage that dog. That could sometimes be breed related, but that's a pretty common thing to happen with more the dynamics, how a dog perceives their environment. Oh, that sounds like a vet question, Samuel. Yeah, you need to address the health issues first because health issues can affect behavior. And I think that's sort of starting to become part of the whole One Health, One Welfare, which is great. I will often work with my with the veterinarian of my client and try and figure out, because sometimes I'll just think, oh, that's, you know, that's just based on that dog's personality, based on how that dog behaves in a lot of situations. That behavior is out in left field. Huh, interesting. I wonder if that came from a physical ailment. So it is important to recognize that diseases, yeah, if they're uncomfortable, just like humans, but that would be more of a vet issue. So you would combine that. But they can get over those. What is the time frame? Oh, to improve the cognitive behavior of adolescent dogs. Well, we can reach the cognitive side very quickly within a couple hours or even less than that. We just get some real basic platform skills and their whole, we can see it change. They don't necessarily need to look at us, but they start to make different decisions. They start to process and think, and you can see it in them. You can see it in just their behavior and their physical, their ears will go, their head will cock. And we know we're getting that side of the brain, which is just so much fun. To address the behavior, the interesting thing about CBT is, like all methods, it relies on repetition. With conditioning, the repetition is in the reward or the reinforcement. I should use the general term reinforcement because it depends on how a trainer applies it. There's lots of different ways to apply conditioning methods, but they all rely on reinforcements. Even counter conditioning uses an associative element as a reinforcement. So your transferable element or your repetition is in that reinforcement. With CBT, the repetition and the transferable element is in the brain, the exercises that allow the brain to stop, process, and make decisions. And we literally practice that at different times, not correlative to the time that might be causing the anxiety or the stimuli that's causing fear, for example. We practice that. So it does take repetition. If you think of yourself as stopping a bad habit or decreasing your fear of something, it does take repetition and you need to build on that. And if you regress and you go off your diet or you have a cigarette, it doesn't mean that you can't go back. You can. You don't have to beat yourself up or punish yourself. There's no negative required at all, but you can bring yourself back and you have the skills and tools to bring yourself back. Or maybe just go down to a level that's a little bit easier, adjust a little bit, adapt and be flexible. But what you're literally doing is practicing your brain. So with CBT, it does take a certain amount of time. That's a good question because it often depends on the pet parent's lifestyle. So if they're around a lot, they're going to have more teaching opportunities to harness those skills and practice those skills. if they're working 9 to 5, because it really does take repetition of the brain practicing doing that. Once they learn how to do it, it's very simple. It doesn't take a lot of time on a daily basis. It's very easy to apply, and it fits right into the person's lifestyle. I would say where I lack a little bit of case study would be dogs literally living in a shelter. I work with tons of dogs that have been adopted from a shelter, but when they're actually in a shelter environment, it would depend on whether that shelter, how much that they interact with the dog, which I think, as we all know, really varies depending on the shelter. But working with fosters, so the dog is still essentially in a rescue, but because they're in a foster home, I'm going to have more teaching opportunities to practice that. But it can happen very, very quickly, which is great because it gives pet parents motivation to keep going and to keep their dog, and they see progress and they see it happening. And then that gets into welfare, right? Then they're not surrendering their dog. They're not euthanizing their dog. They're not resorting to unsavory methods or approaches. They're not getting frustrated. The dog's becoming more part of the family. And that's all welfare. I hope it was helpful. I hope people enjoyed it. I really appreciate people's questions. On my website is Upward, UPWARD, dogology.com. If you could sign up to my emailing list, and you can get my chapter 4 from there of my book, which has got very good response. The book is more on the dog world in general and very general overview of rescued dogs and how they think and learn in the rescue world in general. My podcast is Dog Training Disrupted by Upward Dogology. That gets into CBT a little bit more, CCBT, canine CBT a little bit more. And talks a little bit more about anxiety and fear and aggression. Again, neither of them are step-by-step training manuals, but if you're interested in possibly taking some of the courses that I'll be putting out there, those will be on my emailing list.
Thank you so much, Billie, for that amazing presentation. To us, it's a bit unique because we would have loved to see, the slides and follow, but it's quite okay, no problem. Thank you so much for the amazing work you're doing regarding canine cognitive behavioral therapy. And I've actually shared in the comments the link, to the other presentation that have the slides. So to the participants, thank you so much for joining. Please feel free to turn on your videos. It's time to discuss briefly. So if you have further comments for the presenter, kindly indicate with the use of raise of hand button, then I will unmute you, and then you can, give your comment to the presenter. I will be happy to see your faces. Like I said at the introduction of this webinar, we have 3 major missions, and one of them is to network and to interact with ourselves. So feel free to turn on your video. And if you have further comments, kindly indicate with the use of raise of hand button. So while I'm waiting for that, I'll just like to share briefly some announcements. And if you notice in the link, I put 2 in the chat, I actually dropped 2 links there. The first link is to Billie's presentation for you to know more about CCBT. And also the second link there is for you, if you're still interested in presenting your work on this platform, we still have 3 slots more. So grab it before it's done for the year 2024. And I'm happy to inform you that this year, 2024, we'll be having 13 webinar series. That is excluding Billie's presentation. So we still have 13 this year. We'll be having 4 inaugural lectures, and I'm happy to announce some of them. We'll be having Melissa Bitson, she's in Newcastle University, Georgia Medicine from University of Guelph in Canada, and Lynn Snedon. We have a day for talent show. So if you want to use your talent to say something about animal welfare, be it artwork, be it poem, be it singing, be it drama, whatever you want, the talent that you have, we're going to use everything to talk about animal welfare. Please just watch out on our social media platforms, on LinkedIn and Facebook and on X. So if you have not followed us, kindly do so. And I'm happy to also inform you that our YouTube channel is there where we upload our webinars and inaugural lectures. So feel free to go back there anytime and watch our previous webinars in case you miss any of them. And also, we'll be having a day where we'll be inviting guests to discuss issues as it relates to equity, diversity, and inclusion, because this is something that we want to uphold on this group, where we give everybody the opportunity, to share their idea and their opinion. So is there anybody who wants to give a comment to the presenter? I can see your lovely faces. Happy New Year, everyone.
Good afternoon to everybody, and thank you very much, Billy, for your presentation. We've met again. Great. Just a quick one. We those into this rescue and shelter business. Should you train a foster parent before giving out a dog for him, or that is if the person is already not a previous owner of a dog, especially if the dog is a street dog? And how do you do that before allowing the person to take the dog?
So to home a dog into a good home, I've done that a lot. And it's interesting because I like to do it just getting to know the dog and what's important to that dog, and then getting to know the people. And then what I do is I establish these basic exercises and skills with the dog, and then I teach those to the people, whether the people do it or not. But I think if it became mainstream and became normal for fosters and rescuers to get these basic skills with a dog, and not just sit with a treat, but higher level than that, when we're talking adolescent dogs, of course, because it changes the dog's perception of the new person. They're like, oh, you know what I know. Oh, you're smart. You know how to talk my language and who I am. And so it changes that dynamics, because the dogs think, how do you know that? I know that. My other person taught me that. So it could be something as simple as stay and then open the door and then okay. But something more advanced than just sitting with a treat. It has to relate to what's important to the dog. Did the dog want to go for a walk or want to go outside? And then you can incorporate these exercises in, and the dog just thinks that the person's brilliant and feels a reason to want to connect to them, and feels a reason to want to bond with them, because that person makes sense to them.
Because Billy has mentioned something which is quite interesting to me, that I want her to throw a little more light on. The dog wanting to walk. Currently, we are operating in a place where the dogs mostly are not walked. Okay, they are just kept at homes with people and strayed. So we try to rescue them and put them there. When do we begin to introduce them to walking them? All right, so that they become used to that, and then we move on to maybe other kind of activities.
That is such a good question. I have a reserve dog here with me right now, and he does not see the value in walking. He's got himself into a good home. He likes it here. The thought of leaving this home to go walk around where he could possibly be hit by a car or have to deal with somebody that he doesn't like, he's like, I have no desire to walk. So I don't force it. Sometimes I'll take the other dogs as well, and then he sees a little more value in it because the whole family's going. It's a family adventure that we're doing, but he still likes to come home. So I don't think anything should be pushed. I do more playing with toys at home with him, or in the yard. But yes, that's right. They don't often see the value in walking around a neighborhood that they've been trying to survive in. It's a very fair question, and I think we need to recognize that.
I was just wondering, because it seems to me that some people might be a little bit skeptical in adopting dogs from shelter homes, not having an idea about the previous experience of the dog and things like that. So what can you advise about this, or what are your thoughts about this?
That's a really good question as well. Plus, how they are in a shelter can be quite different than how they are when they get into a home. So adopting a dog from a shelter is even quite a bit different than adopting a dog that's come from a foster home. And the foster home might be very different than your home. They might have a different lifestyle. They probably do. That's what I love about canine CBT is it doesn't really matter where the dog has come from. The concept of it can be applied and adapted to suit that dog, and to, as soon as we do some platform skills, which are using basic commands, but they're used differently than teaching just puppy. But once we, and it does take a little bit sometimes of a trick to, it could take a day or two to figure out, again, what's important to that dog and how we can create that communication. But it doesn't matter what the history is. It really doesn't. You're going to have different issues and different, it's impossible to say that every dog from this situation is going to be the same way. People aren't even like that. Lots of people come from different, the same situation, but they become different people. So I don't think one should be turned off because a dog came from a certain environment. People who get dogs from the best of breeders, they're still dogs. They still have personalities, and they're still going to have to learn how to work with that dog and to communicate and to connect with that dog. We all have to do that no matter where a dog comes.
Hi.
Hi.
I like to know about the fear behavior in dogs, because this behavior is different among dogs when they come to vet clinics. Some of the fear is very much in them, and some of them are easy and comfortable with other people. And I see that many of the dogs from good families have the fear more than the shelter dogs. I like to know your opinion.
That's a very good observation. And most people wouldn't expect that, but you're exactly right. And I think often dogs who have come from the street are more acclimatized to processing and reading new situations and different situations, and they have the cognitive skills to do that more quickly than a dog that has had a very structured or routine upbringing and lifestyle. So when something is different, it affects them differently than a dog that has had to deal with lots of changes, sporadic, unpredictable. So I think it really is the ability, just like with humans, to be able to process a new environment without going into that state of panic or fear. So if I were to work with a dog and a veterinarian referred me to say, hey, this dog is very fearful in the veterinarian clinic, you should, they might say to their client, try canine CBT with upward dogology to address that. We would actually practice that dog's skills and ability to process without panicking, in using the ability to bring back the brain, process decision making, CBT, to do that, and then take that to the vet clinic. Sometimes, as per the fear-free movement, using conditioning, they can use associative or reward-based, so a treat can make them feel happy and comfortable. But often a dog that has a high level of fear won't take the treat, or will feel as though why are you trying to get me to take the treat? So it's good to have multiple different ways of getting dogs comfortable in new environments. The vet clinic is just simply a new environment, really. It's enclosed, and people are doing weird things. But the biggest thing to remember is that the goal of a veterinarian is to complete a task, not necessarily to address the entire anxiety in that moment there. So it's a bit challenging for veterinarians because they need to achieve that task in an enclosed environment. So working with that dog outside of that environment in their regular life and allowing for those skills to develop, the cognitive skills of processing, will help in the vet clinic.
So with that, I say thank you once again, Billie, for coming on this platform to share your ideas. To me, it seems I can now relate it, looking at from the human perspective. When a child is growing and it reaches to, you know, the time of puberty, you'd see them behaving in a way that maybe don't come into my space or things like that. So I can actually relate to what you're trying to talk about that is happening in the lives of dogs as it relates to human beings. And I believe everybody, we've been able to pick one or two things from today's webinar. And then with that, I'll say thank you so much, everybody, for joining the meeting. And the next webinar would be on the 2nd of February. And I'll say bye-bye till then. Thank you so much.
Thank you,
Bye,
everyone.
everybody.
Thank you.
Thank you. Bye.